This video will give advice on acting on the feedback you obtain from your assignments in order to improve your grades. This is what will be covered by this video workshop. Think about the feedback you've received so far. What are the strengths of your work? What are the negative things that you can improve? Are there any recurring themes where the tutors are giving you the same feedback over and over again? And how do you feel when you receive the feedback? Happy, neutral, a bit angry, a bit worried or scared? These initial reactions are perfectly normal. The important thing is to step back after that initial reaction and then look closely at the feedback in order to improve. And don't take the feedback personally. It can feel like that when so much time and effort has gone into assignments. But your tutors are giving you feedback in order to improve your work, so you get the best grade possible from your course. Here are the most common mistakes identified in students' work. These will be looked at in turn in slides that follow. When you receive feedback from an assignment, check it carefully to try and identify what are the major problems and what are more minor problems, and come up with an action plan for improvement. Usually, the overall comment down the side of your assignment, if it's received back on Blackboard through Turnitin, gives the big overview. And often the smaller points on the script will illustrate examples of good practice or problem areas. Use this feedback to divide it into these major and minor issues. So an example of a major issue could be you're not using evidence to back up what you say. So it looks like something that's just your own opinion. This can result in assignment failure or at least a very low mark. So this is important to address. Now, how are you going to address that? It could be that you need more assistance with finding good information, in which case you could look at library videos on searching for information, or you could make an appointment with an academic skills tutor to go through searching for information in your subject area. So there is something you can do to address that. Too much description, not enough analysis is a big problem area that loses a lot of marks as well. Or it could be that you're being asked in your learning outcomes to evaluate or compare and contrast something, and you've not done that. More minor issues could be poor punctuation or sentences that don't quite make sense. But the main thing is to address the major issues first and decide how you're going to do it. What resources are available to me to actually improve? Then the minor issues can be done as time permits. Sentences that do not make sense is a common problem identified, and this could be because of poor grammatical skills or that the assignment has been rushed without proofreading. Sometimes the sentences can be very long. This is something I do when I write my drafts of writing, and I need to proofread by reading aloud to identify these and shorten them or divide a big long sentence into two or place some commas for pauses. Here we've got two examples which you can pause the video to have a read, and you should be able to see if you read them out loud how they don't make sense. Another problem is when writing is poorly structured. The whole assignment needs to have a structure to it, a logical presentation of themes in between an introduction and conclusion, usually within an essay. In addition to this, each theme, or if it's a paragraph within a theme, needs to be structured in a logical order as well. It can help to put headings in your work for themes that can be taken away later if needed, but under these headings, you bullet point the main things that are going to be said. Then you can put them in a logical order before actually writing them up. In the example we've got here on the left, we have somebody talking about pressure ulcers in the first sentence. And in the green second sentence, they're talking about a consultant and a care company, with the third sentence going back to pressure ulcers again. So clearly, those pressure ulcer sentences should have been grouped together with that green sentence about the consultant and care coming somewhere else in the work. So think about your whole structure and think about, if you like, the more mini structure of your paragraphs within that. Work not being analytical enough is a major problem. It starts with actually looking at your learning outcomes and identifying the words they're asking for, the evaluate, the compare, the analyse, the critically analyse, the apply. By just producing descriptive work, there's the risk of failing the assignment or dragging those marks down. There's an example on the left of some descriptive work. It's just relaying information about pressure ulcers. Now, if it was needed to be more analytical, this can be done sometimes by thinking, after you've produced a particular paragraph, what has this got to do with the essay title or the learning outcomes? And maybe you could write a bit about that. You can ask yourself, what is the impact of this on patients, clients, the service like the NHS, or the staff? You can think about what is best practice, and can this be linked to any frameworks or guidance? You can think if any laws could be linked in, if that's what's required by the assignment brief. You can think about, what if things go wrong? We're talking about pressure ulcers here. Well, what if they go on within a patient and they get worse? There's severe consequences potentially for the patient, but also in terms of the NHS and the care that a worsening condition could require. Maybe a hospital stay is elongated. This will cost more money to the NHS in the long run. So there's lots of things you can think about, some questions to improve your critical analysis, to really dig into the issues. Anything you say there, though, will have to be backed up by sources of information. A common piece of feedback that sometimes isn't well understood by students is that work is not academic enough. And what we're talking about here is firstly making sure that sources of information are used to back up what is said, but also that the sources of information used are good academic sources. So, for example, the BBC is not considered an academic source of information. Things like Harvard Medical School medical information, despite it being from a university, is not considered good academic information, and this is because it's meant for the public. So any of these sources are medical information for the public and not academic. You need to be looking at academic books, e-books, journal articles, and there's some professional or good websites available in your library subject guide, or maybe your tutor will give you some websites that will have good quality information for your subject area. If this is a problematic area for you, then as mentioned before, you can take action to improve your ability to search for good academic information. Another major problem is work not reflecting the grading criteria or learning outcomes. Look carefully for those doing words in the learning outcomes. For example, a problem can be with compare and contrast essays. Some psychology or counselling essays can ask for certain counselling approaches, such as CBT or PCT, to be compared and contrasted. It's a mistake to just describe one CBT and then describe another PCT without actually gathering together their similarities and then looking at the differences and talking about those. Just to write about one followed by the other is not comparing and contrasting, would not fulfill that grading criteria. So at the start of any assignment, really familiarise yourself with this grading criteria and learning outcomes. Ask your tutors if you're not sure. Keep looking at them throughout so you don't lose track of what's being asked, and use it to self-evaluate at the end before you hand in. A lesser issue, but one that can cost valuable marks, especially over grade boundaries, is lack of proofreading or grammatical and English mistakes. It's important to read through carefully before handing, and sometimes it's good to allow yourself time to step away from the assignment and come back with fresh eyes after a few days. You tend to spot mistakes better that way. Some people have difficulty spotting small mistakes like full stops instead of commas. It can be useful to print off the assignment and read it off paper if that's the case for you. Proofreading by reading aloud or using the Microsoft Word Read Aloud can help to see if it makes sense. Or is there a friend or family that could read it through for you and make sure they understand as well as could be expected for a lay person? Before you hand in, preempt the feedback. What if you were marking this piece of work? Gather any grading criteria, learning outcomes and assignment brief. Go through and ask yourself, if you were marking this, have all these things been achieved or been carried out? That's for the content. And then there's the academic skills side, where you can look at things like your writing, citing, referencing, and many other things in turn. And you can do this by using a checklist such as that's available in the Study Skills Handbook by Stella Cottrell, shown here. So have a look carefully and evaluate. The most important thing is that those learning outcomes are covered. So to sum up, remember, don't take that feedback personally. Step away from it if needed, and then come back once you've had time to initially digest what was said. Prioritize the major issues. What do you really need to address first in order to improve your marks, and leave the more minor issues till time permits? What can you actually do to address these things? What resources are available to you, both inside and outside the university? And always evaluate your own work before you hand in, especially in terms of the learning outcomes. Further help and support and resources to help you address your feedback are available through the library web pages.